Ashleigh Moore, and welcome to Wake Up with Speech and OT. Today, I am joined by June Smith. She is an occupational therapist with South Shore Therapies who have been with us since we opened over 17 years ago. She is Brain Gym certified. She is sensory integration certified. And today she is joining us to talk about vision. June, thank you so much for coming on today.
Thank you for having me.
Of course. Well, we know this is one of your passion areas, and this is something that you have gained a ton of knowledge in over the years. So please tell us, as an occupational therapist, how did you become interested in this area?
Well, you know, as an OT, we were trained a lot in eye-hand coordination and fine motor skills. And that was sort of our specialty in our training. And over the years, I kept seeing children that were just struggling. And it seemed like their vision was just not being attended to. A lot of them weren't going to the eye doctors. They were having visual issues, but I just couldn't pinpoint what was happening. And I felt I needed more training and more experience to learn about the eyes and vision and how it impacted learning.
Very nice. And so how did you learn more about this? What experience did you have to gain, and what training did you accomplish?
Well, over the years, I went to as many vision conferences as I could from really well-respected eye doctors and developmental optometrists in the field. And I also had the ability to work on a grant and run a vision clinic at a special needs school. And that ran for many years. So I trained under a total of about 7 eye doctors to gain more experience.
Wow, that is fantastic. So some parents, and I think this is the root of our conversation today, some parents are educated that seeing a pediatrician or seeing a school nurse to get a vision test is sufficient for children. But today we're going to talk about why it's so important to dig a little bit deeper. So what more do parents need to know?
Well, I do think it's a common issue that parents will hear, oh, my son or daughter, you know, they pass a vision screen at school or at the pediatrician's office. However, that is really just a very basic screening. And it usually does not include the health of the eye, which an eye doctor would have to do by looking into the eye. And it really is typically focused on distance vision. And many of our kids actually have trouble at near, and that's where some of their problems occur. So really, I would say my biggest hope through this day is to really have all children evaluated by an appropriate eye doctor, preferably one that has experience working with children.
Yes, absolutely. And to bring that knowledge to our parents is really important, is because if we're not being able to see things clearly, right? It's the root of so many tasks that we want to accomplish throughout our day. So,
exactly.
Yeah. And I hear there are some common signs and symptoms that you want to share with us.
Sure. What I'd like to kind of highlight in this list, so these are some of the problems I commonly see, but when a child is first getting their evaluation from an eye doctor, the eye doctor is going to look at their acuity and see, as Ashleigh just said, 20/20, do they have 20/20 vision? But in addition, an eye doctor with more of a specialty will look at their ocular motor needs, how they do with tracking that you need for reading, and different eye skills like saccades, pursuits, and convergence. So these basic foundation skills are needed to be successful with learning all the academic skills children need. And when those aren't in place, I commonly see this list of problems. So kids will compensate by tilting their head. They're attempting to get a clear visual image. They might be complaining of headaches. They won't look at you in the eye, but maybe it's because they're getting a double image when they look at you. Many times you'll see the kids be way too close to the page. They might be just 4 or 5 inches away rather than 15 inches is a common and best distance for distance from the page. Definitely one big one, and it's a subtle one, is covering one eye. So sometimes children will do this by just closing one eye, but they might also be looking at their homework and very subtly covering one eye or letting their hair be down to cover one eye. That's a big red flag for being a concern for double vision. They also might, things when you're drawing a horizontal, you have horizontal line, for example, you have to use both eyes together in order to have a clear midfield. And many times you'll see kids, instead of wanting to draw horizontal, turn the paper and draw it vertical, because that is easier on the eyes. So you'll see just a lot of compensation with head and body movements or looking out of the corners of their eyes at things.
Wow, that is such an interesting list. And it's great to have this because we can then be advocates for children in this way. Because, you know, when you have kids, you're not expected to know everything under the sun. So it's really important to have this information. So are there any of these that are particularly concerning to you?
Well, I would say the one that's probably the most concerning is the covering one eye, because that one area is a sign to me that that there may be some problems with convergence. And convergence is that ability as an object comes toward your eyes and then goes back away, divergent. So the children have trouble often with following that with their eyes symmetrically and going back out. They sometimes have eye turns, they'll complain of double vision. And it's very subtle. They don't tell you always outright, but they kind of internally know something's wrong with their eyes. The brain cannot handle a double image. So if a 2 that they're looking at for their math problem all of a sudden looks like a 22, they're going to close one eye so it goes back to being a 2 because it just went double. That's the most disrupting, and it can weaken the weaker eye and cause multitudes of problems that need to really be identified by a reputable eye doctor.
Wonderful. Thank you for sharing those. And I want to make sure people get a good image of what you were speaking of. Would you mind modeling the convergence again and giving people another example of that?
Sure. The convergence would be one way we screen for it. And eye doctors do this not with a pen, but there's a special little tool or a small image. And as you bring the small object right between the eyes, you'd expect the eyes to go symmetrical and keep a clear image till only about 2 to 4 inches away from the nose, and then again be symmetrical as they go back out. That's very challenging for some children, and we do often screen for that as part of our OT evaluations and treatment. However, the children really need a more in-depth evaluation from an eye doctor, and there are different types of eye doctors. So for where parents go, I often suggest using the website COVD, which stands for College of Optometry and Vision Development. And you can put in your zip code, you can pull up reputable doctors that not only look at the visual acuity, but their ocular motor skills, because the acuity is just that 20/20. Can they see a certain size object at a certain distance? But the ocular motor skills really support learning, and the convergence helps the eyes team together as a team to give a clear image. And when kids are struggling with these areas, they often want to get up out of their seat, because when they move around, it kind of helps their eyes, it feeds their eyes and helps their eyes like work together. They often can look like a little bit like ADHD because they keep wanting to get up out of their seat, but sometimes movement supports the eyes. And so we're not only looking at doctors like ophthalmologists that specialize in eye health and surgery, but we're looking at the role of a developmental optometrist or a behavioral optometrist that really assess the efficiency and the function of the eyes.
That is such great information. It is so important to be able to look at a child holistically and understand that sometimes speech therapy or occupational therapy is just one piece of looking at that child holistically. So to be able to offer that website, and it will also be linked in our video in our notes for our video, so that you will be able to go to that website and put in your zip code and find all of the different specialists that June just mentioned. So are there other places that parents should go, or other resources that we have provided for our parents today?
Well, I think we will include like a full resource list that are books for both occupational therapists, a guide to occupational therapists for vision deficits, and that's by Dr. Scheiman. There are other books for parents that like Jillian's story, and that talks about how a mother discovered with her 5-year-old daughter that she had vision issues and never knew that prior.
Wow.
And so there's many great resources that are out there, but you can always refer to the American Optometric Association as well. They recommend having a child's eyes tested at 6 months, at 3 years and 6 years for a full eye exam. And that is, the suggested time frame. However, if there are special situations noted, you'd of course do it more often than that. So that's a good resource, and as well as a program called the Infant C program. Infantc.org will show you the eye doctors that are trained to evaluate a child under the age of 12 months for free, and they have special training to evaluate an infant. So that's another really good resource as well.
Those are great milestones to hit. Thank you for sharing that, June, that it is recommended that it's 6 months and 3 years. And you said also six years, if I'm not mistaken. Great. So those are some excellent action items for our parents as well, something to look out for, to put on the list as far as checkups go with the pediatrician and the dentist and all of those other checkups, and add those right to your list as your child is developing.
Exactly.
Wonderful. Well, any final thoughts? Anything you'd like to share?
Well, I appreciate everyone's interest in this topic. I find that, especially in the special needs population, primarily, we see these issues a lot. I would say about 80 to 90% of the children walking in the door can often have these issues that have never been identified before.
Wow.
So this is not a very small need. It's a very big need to really address and to take seriously, because so much of learning comes through the visual system. And the more we can support our kids and be sure that everything is being done to support them, it's going to just help free up their eyes for learning and doing all the play skills that they want to be successful at.
Absolutely. Really well said, June. Well, thank you so much for joining us today. It is Pediatric Vision Awareness Month. So how appropriate that we are offering this conversation for our parents and our greater audience. So if you need more information and more resources, we will link those in this video. And I will say thank you so much, June. Thank you for joining us.
Thank you for having me. Have a great day.
Take care.